So health economics is one of the pillars of the three that we usually talk about, which includes the clinical, humanistic, as well as the economic outcomes. Economics is about the healthcare resource allocation and clinical efficacy and use of the limited resources. And there's always a need to understand how new interventions from pharmaceuticals as well as medical devices impact the economics of a country, a payer, as well as from a societal perspective, how they may impact the lives of caregivers as well as patients. And really, as I talk about it, the health economics is an umbrella term for a number of different audiences and how it may impact their lives and their economics. So it eventually asks the question, why should I reimburse a new intervention, or what advantage does a new intervention bring to my budgets or my financial budgets given the current medical scenario or current market landscape? And at the core, every third party or insurer decision is to some extent based on what the coverage is going to look like and what the economic impact of a new medical technology will be. So having said that, facility decisions regarding the purchase of a new medical technology are often going to be based on what is going to be the overall impact to their budgets, how much shifts is going to cause in their financial budgets at the end of the day. And the science of health economics may not be understood by all players equally in the healthcare value chain. And we'll talk about this in a little bit in more detail of what specific outcomes do each payers or do each audiences care about. But in general terms, the tenets of health economics are the core of every strategy and every decision making. Whether those are payers, physicians, patients, or providers alike. And from a manufacturer standpoint or from a medical device standpoint, market success requires a demonstration of both clinical as well as economic value to healthcare decision makers. The health economics data will help drive the data-driven solutions, analysis frameworks that will articulate into a value story for coverage, coding, and reimbursement. And overall, it presents a persuasive story to the desired payers. Like I mentioned earlier, economics is one of the pillars, key pillars within the ECHO model of clinical, economic, and humanistic outcomes that payers, providers, and patients want to look at. And as I mentioned earlier, every decision, whether they want to go, some payers want to invest or not invest, reimburse or not reimburse a new medical technology, will ultimately boil down to what are the economics of incorporating a new technology into the system.